Welcome to On The Beat, everyone. I'm Troy Thompson, sitting here with the wonderful Dr. Andy Barlow from Chiropractic Physician Centre of Tupelo. Now, Dr. Barlow is the author of the #1 new release book on Amazon, Licensed to Heal, What to Do When Traditional Medicine Has Failed. And today we're talking all about fibromyalgia. Welcome to the show, my friend.
Thank you, Troy.
Nice to see you again.
Nice to see you.
All right, fibromyalgia. I've forgotten what it is.
Okay.
And I know I've talked about it before.
Yeah. Well,
what is it for everyone at home that maybe be thinking like me?
Okay, well, the simple term for fibromyalgia is just pain in different areas in your body. The term for it actually, to be properly diagnosed, if you will, there's like 11 different spots in your body in which a person needs to have pain. Like, for example, it could be neck pain and shoulder and neck and elbow. So basically just pain in multiple areas of your body.
Well, what's causing that?
Okay. Well, a part of this could be trauma, like from decades ago. Sometimes people, when they start to have these problems, they look back and go, well, what did I do last week or last month? And a lot of the patients that we see in our clinic with this condition have actually had trauma, like a football injury, a car wreck, decades ago. And then what happens is, over time, from that trauma, and then now the body starts to break down, and 10, 15, 20 years later, they start to see this pain in their neck and their shoulders and their elbows and hips. So,
now, do you think it's because it wasn't treated properly the first time, or it was treated, but you haven't done things to maintain it?
And it could be a combination of the two. They may have been misdiagnosed or mistreated at the beginning, and I know that patients don't like to hear this, but sometimes patients don't follow the doctor's best recommendation.
I'm the worst. I'll put my hand up.
And so it's multifaceted. It's really not just one thing. And then, because people, like, I'll just use trauma for example. Well, it was a fender bender, and then I go, well, tell me what happened to the car, and they'll say, well, my car was totaled. Well, the thing is, if the car's totaled, you're totaled, because the car is made out of plastic and rubber and steel, and we're made out of blood vessels, bone, and nerve, and we're going to lose every time in that trauma.
And that's something, one of your messages is about taking care of the body.
Yes.
How does your approach to clients benefit them?
Well, one of the things that we're going to do is we would actually take radiographs, also known as x-rays, and see, when we look at the side view of our neck, we should actually have a curve in it. It's called a lordosis. And so it's a C-shaped curve, and so when you have trauma, typically that neck goes into a military neck or a straight neck, or it can actually go in the reverse position. And that can cause headaches, even migraine headaches, neck pain, shoulder pain, elbow, wrist, and hand problems, because the nerves that come from your neck control all of those functions.
Is that C-shaped on the side?
Yeah.
And is that something that we can visually see, or only you?
Actually, you can't see it in person. You have to. I know you have to take radiographs or X-rays to see that. Okay, and so once we take those X-rays, we can actually see the position of the neck and see if it's normal, if it's abnormal, or how much damage is in there.
Would that then be a system of chiropractic work to adjust and fix those things?
You could do chiropractic care, you could do physical therapy. There's a lot. Massage therapy can help with that. Laser therapy can help with that. There's a lot of things that can help with the pain and the suffering that's in the neck. One of the things that we would use in our clinic is laser therapy and some other types of therapy to help with that.
I want to ask you a question off topic, if you wouldn't mind. What do you most enjoy about these type of conversations, especially when it comes to your book? Well,
I think, for me, the #1 thing is people are sitting at home today and they're like, nobody knows what to do. Yeah. And maybe in the traditional standpoint, people don't know what to do, but that doesn't mean there can't be help and people can't change their life.
And you're giving them a tool to sort of research a little bit to begin with.
Yes, I am.
We appreciate you. If you want to find out more information, there it all is up on the screen, everyone. Dr. Andy Barlow from Chiropractic Physician Centre of Tupelo. And let me tell you, grab a copy of his book, Licensed to Heal. Back after this short break.